Good morning, everyone. We're so delighted to join you today. The stage certainly has been set this morning by our keynote speakers on what it means to dive deeply into the issue of workforce development for nursing in the home and community-based settings. Janice and Abdul, in their compelling video, highlighted the opportunity we have to come together as academic and clinical partners to view workforce development not just as a challenge, but as an opportunity to drive health equity and inclusion, workforce diversity, cultural competency, in appreciation of the ever-changing demographic shifts. Bill Emerson's keynote remarks highlight the impact that the pandemic has had in accelerating our need to rethink nursing education and preparation. And Tracey really has brought that home with very concrete insights into what it takes to be a high-performing, best-in-class employer and provider of home and community-based services. Today, we're going to explore these concepts in more detail with a very distinguished panel of healthcare leaders. During our time together, they are prepared to share their insights into workforce development 2021 and beyond. To get us started, I thought I would offer a very brief intro into each of my colleagues' backgrounds, and then ask them to just share a brief overview of their organization in terms of size, services rendered, and the like. I know I don't need to spend a lot of time on Tracey's introduction because you've met her already, but in the event that you joined us late, Tracey is the former COO of Home Health and Hospice for Encompass Health. She has extensive background nationally in scaling large healthcare providers and is an industry leader dear to all of us with national prestige. Tracey graduated from the University of Texas with a bachelor's degree in biology, and her passion for what we're going to discuss today in terms of workforce development and mentorship certainly are legendary in our field. So Tracey, let me hand it off to you first.
Thank you. As noted, Encompass Health does provide both home health and hospice services across 31 states. We did home health services from the get-go and then added hospice services in 2011. There are a wide plethora of positions and disciplines that work for the organization. Our primary employee group are nurses, of course, both registered nurses and licensed nurses. They make up the biggest part of our workforce. We also employ therapists, PTs, PTAs, OTs, CODAs, SLPs, primarily in the home health sector of the business. We have nurse practitioners and chaplains that support our hospice services. And we also have home health aides and hospice aides that work throughout the organization in conjunction with social workers. Currently, there are about 13,000 employees in the organization. I think that describes a little bit about our base. Thank you.
It does, and we all have such regard for the great work that you've led, Tracey, and the work that Encompass does every day. So thank you for sharing that. Our next panelist is Jeannee Parker-Martin, a dear colleague and friend, who's the president and CEO of LeadingAge California and vice chairman of the Carter Group Holdings, where she was the president and co-owner for many years. And that's the role in which many of us got to know Jeannee. Jeannee has really helped to span healthcare delivery across the globe, even in working with the World Health Organization. She'll have important perspectives to share with us today in 2019, having been appointed to California's Master Plan for Aging, and more recently and very relevantly in 2020 to the federal CMS Coronavirus Commission on Nursing Home Quality and Safety. So we know that those perspectives will be woven into her comments. Jeannee has a master's in public health from Yale University School of Nursing and a bachelor's of science in nursing from Georgetown University. So Jeannee, please help us understand the work that you've been leading through this crucial time.
Thank you very much, Mary Ann, and I'm so honored to be on this distinguished panel of colleagues and leaders in the field of home health care and also in so many other aspects of healthcare. So thank you very much. LeadingAge California is a trade association based in Sacramento, California. We focus on advocacy, education, and public awareness about the needs of our older adults in California who live in retirement communities, also known as continuing care retirement communities or life plan communities, in assisted living facilities and skilled nursing facilities, and in home health, hospice, and other home and community-based settings like PACE. Our work has been very, very focused on workforce development, which you'll hear me talk about a little bit later in the partnership discussions that I'll be doing after this panel. So I'll save some of those comments for then, but this particular topic today is critical to our survival really here in California and how we focus on the needs of older adults and those with disabilities. And we're happy to be a part of this development and also of the establishment of certain criteria as we move forward. So thank you.
Thank you. And thank you, Jeannee, for being the voice of an entire industry sector. I think that really enriches our discussion today. So thank you so much. Next, we have Gary Charland, President and CEO of Masonic Homes of California. Gary has more than 25 years of experience in healthcare leadership, comes to us as a previous career as a practicing attorney, and then worked for the Washington Hospital Health Service. So certainly understands the continuum of service, and that will be very important for us to consider as we think about this notion of right place, right time, right position, which Tracey highlighted, of course, in her presentation. Mr. Charland received his Juris Doctorate from Quinnipiac School of Law in New Haven, Connecticut, and his undergraduate degree in Communication, Journalism, and Psychology from the University of Bridgeport in Connecticut. And, you know, Gary, we're so interested in learning about the terrific work that you lead at Masonic Homes.
Great. Thank you very much, Marianne. And it's a pleasure to be here on this panel today. The Masonic Homes of California provides care and services to senior Masons throughout the state. We have about 40,000 senior Masons currently, and we take care of them in a number of ways. Number one, of course, we have 2 residential campuses. We have one in Union City, which is in the Bay Area of California, another one in the LA County, where I am today, actually, in Covina. We also do a significant amount of our work through outplacement services. And so we take care of Masons throughout the state of California, which is incredibly large. And so we have a very robust program for these outpatient types of services. So we're able to provide care for well over 1,000 Masons actively, including financial support. We have over 500 employees right now. And in addition to that, we're also providing another service, which is the Masonic Center for Youth and Families, so that we can provide behavioral health services for families. So we provide a lot of different services. And of course, that means we also need to have a very well-educated and well-prepared staff in order to do that.
Thank you so much, Gary. And just, you know, you're highlighting the behavioral health service that you provide. I think increasingly a spotlight through this pandemic has been placed on the criticality of addressing behavioral health needs. So thank you for sharing that. And I'm sure we'll delve into that a little bit in our discussion today. So thank you so much. Next is Lynda Tanner, who joins us, the president and CEO of VNA Health. Lynda has an extensive national profile in home health and hospice with over 35 years, previously having served as an accreditor for the Joint Commission and also a national consultant for the Corridor Group, where many of us got to know her great work. In addition, she was a chief clinical executive at Sutter, VNA, and Hospice, so comes with a terrific background that really enriches our discussion today. Lynda graduated from Idaho State University with a Bachelor of Science in Nursing and a master's degree in nursing administration. And we're just delighted to have you join us today, Lynda. Your mic.
Thank you, Mary, and I'm sorry about that. I'm from VNA Health, and we are located in beautiful Santa Barbara, California. We are quite a long-standing organization. We've been there for 113 years, so we're part of the fabric of that community. We have a branch location up in the San Ynez Valley, and we provide home health and hospice services, along with palliative care. We also have an 8-bed inpatient hospice facility up on the hill. It's a beautiful views, and it's a great place for people to come at end of life that need to. We have all disciplines, as I think Tracey spoke about, mostly nursing too, also. Almost half of our staff are nurses. And then we have, therapies and social workers and chaplains and all of the other disciplines. And staffing and attracting staff is one of our biggest challenges.
Well, we all share that. So I think this will be a nice learning opportunity. And thank you for kind of sharing that really rich image of nursing in your organization being part of the fabric of a community. And we have to think about how we interweave that through nursing education. So thank you so much, Lynda, for sharing that. I think that's so very appropriate. Jen Johnson joins us as the National Director of Care Management at Atria Senior Living. Jen has held a variety of divisional roles throughout California. She's been a nurse for over 20 years. And what I think is so interesting about the comments that Jen is prepared to share with us today is this, just the fact that she has the ability to kind of see both from an enterprise and local level the way that care is delivered and the challenges and opportunities across the many states in which Atria functions, including the Canadian provinces. So we're very interested in those perspectives coming out in our panel today, Jen. Thank you so much.
Thank you. Atria operates in 28 states across the US, 7 Canadian provinces, as Mary shared. We offer independent living, assisted living, and memory care in many of our environments. Our disciplines, we have our biggest department is care, which we hire nurses as well as RSAs, which are caregivers, and RMAs, which are med techs. And depending on the state you're in, it could be a QMAP with an additional certification. We also have departments of maintenance, culinary, activities, all types of things to entertain the residents while they're in our environment. It's, to me, one of the most rewarding positions I've been in. So it's and during COVID, it's been quite a challenge also. Thank you for having me on the panel.
Well, thank you for the work that you've done in leading a very fragile population through the pandemic. We know that it has not been insignificant with its challenge. So thank you, Jen. And I'm sure some of those perspectives will come out in your comments today. Next, joining us is Charles E. Symes II, founder and CEO of Alegre Home Care. Charles has really dedicated his life, and you'll hear that in the comments, to not only being a customer-centric employer, but also an employee-centric performer. And some of the compelling lessons that he's prepared to share with us today, I think will really amaze so many of us. Because of his dedication to diversity and inclusiveness, Charles made sure that his in-home care agency in California was the first LGBT certified one. And that's something for all of us to take away and learn from. So Charles, we're just delighted to learn more about the work you're doing. And as we get into the presentation, I know you're going to share a lot of the unique methods you've used to honor your commitment to patient and employee. So thank you.
Oh, thank you very much for that. Well, my agency is from the long DNA of how services evolve from Medicare and hospital-based skilled nursing. And so I learned many years ago, starting back to 1983, when there was the traditional home health and hospice, home health and counseling, all of those services coming in from a skilled nursing and therapist perspective. And so much of that was only intermittent services. And so the non-medical home care world is a direct result of not having access for paid services by Medicare, for example. There's so much that is not covered under the Medicare benefit or a private insurance benefit that is still needed to help folks who choose to age in place or recover from an illness. And so the non-medical home care services really fills this niche, especially for the middle income folks who have to plan ahead and make sure that they have properly trained caregivers. All throughout my career, the non-medical home care industry was never regulated. There was no standard. There was no minimum bar to reach. There was no educational requirement. And so working through the trade associations such as LeadingAge California and CASA and the home care associations, minimum standards were put in place to ensure that training, supervision, and higher quality services were available even to those in the private pay market, not covered by a public benefit. So I look forward to speaking to that. We serve most of Northern California with 9 locations all throughout the San Francisco area. We're certainly not a national organization, but we are committed to the local community with opportunities nearly throughout all of Northern California.
And that local commitment has certainly been evident in the work that you've spearheaded, Charles. So I'm glad we're going to learn more about that as we move forward through the panel discussion today. And I think the points you raise about the limitations in reimbursement for particularly the needs of the middle income is very poignant and has been a challenge that many of us have shared with you. So thank you for highlighting that for our participants today. And now we'll turn to Rayne Soriano, who's the Regional Director of Professional Development and Education for Kaiser Permanente. And Rayne is actually in his 24th year at Kaiser Permanente. He's done a lot of work, obviously, with professional development, mentorship, has a deep seated commitment to mentorship. And that's such an important part of our thinking around workforce development, but has also done a tremendous amount of work in terms of performance improvement for the services that disproportionately affect the elderly, and has perspectives that he'll be sharing with us today about particularly those in medically underserved areas. So we're delighted about that, Rayne. Rayne graduated from the University of San Francisco with a BSN, an MS in nursing education from Sacramento State University, and a Ph.D. in nursing education and healthcare leadership from the Betty Irene Moore School of Nursing at UC Davis. And again, just this whole notion of mentoring the next generation is something that I know is very dear to Rayne's heart. So Rayne, tell us a little bit about the work that you're leading at Kaiser Permanente.
Thank you so much, Mary, and happy Friday, everyone. Where we made it again. And so thank you so much for having me. And so although Kaiser is a national organization, I represent our Northern California region, where I'm honored to serve, our 4.5 million members, of which a little over 630,000 are Medicare enrollees, and with 10,000 each day enrolling in Medicare, that population is certainly growing, to your point, Mary. And we have, 21 medical centers, hospitals from Santa Rosa, California, all the way down to Fresno in Northern California, and 24,000 and growing number of nurses. And so my job is really, to your point, Mary, succession planning in all ranks and aspects of nursing care, as well as patient care altogether. And so partnerships with the community, partnerships with schools such as Unitek is huge. We just launched our residency program for new grad nurses, and really looking forward to sharing with you plans for expanding education and development in the organization to serve the various communities we're in. So thank you so much for having me.
Well, thank you. And, many of us throughout our careers have really looked to the nursing leadership at Kaiser Permanente kind of as our North Star. So we're just delighted you could join us, Rayne. Thank you so much.
Thank you.
Yeah, terrific. Now I thought we would kind of turn our conversation to the unique challenges and opportunities that your individual organizations have faced in terms of nursing workforce development, particularly, in the past year and what you're thinking as we move forward. So we're going to kind of hand it off to Tracey first to share some of her perspectives.
Thanks, Marianne. I would say our first challenge is in the recruitment process. working independently in the patient's home setting without the benefit of coworkers at hand can initially feel overwhelming to applicants. So it will deter them from applying for a position or even accepting a position once they know a little bit more about it. I'd say our second challenge is that we do struggle when nurses are offered very large sign-on bonuses to work in acute care facilities, as we don't offer that level of bonus in the home care setting. The third challenge would be our staff being able to perform comprehensive and defensible documentation. Those skills can be overwhelming again in the beginning for employees. And so I think being able to set a stage for them to better understand the importance of that type of documentation is a good challenge to get over. And then lastly, participating, something very basic, but participating in on-call rotations sometimes takes a little getting used to, as the frequency of your on-call duties can vary depending on the size of the home health branch or hospice branch that you're affiliated with, and of course all the other nurses in the rotation. But when I think about opportunities, there are two that come to mind. I think the first opportunity is partnerships with learning institutions to include a training focus on developing nursing assessment skills and decision-making skills, so that you in fact will lead that applicant, that employee, to a higher level of confidence and competence that you need to have in an autonomous care setting. And then I think our second opportunity is supporting more complex patients that are receiving care at home, and really just being ready to be part of that hospital at home level of service. Thank you.
Thank you. That certainly, I think, is a great synopsis of where we need to go. So thank you, Tracey.
Mm-hmm.
Jeannee, how does that look for LeadingAge and your constituent members?
Yeah, thank you, Marianne. This has been just such a challenging year, as we all know, this past year. And I think the pandemic has really highlighted not only the lack of workforce, the disparities in workforce, the income levels of workforce, the low wages across many disciplines in the workforce. And our 700 members, who I mentioned before, represent a spectrum of the out-of-hospital service field, really. Many of them require nurses, registered nurses, LVNs, and CNAs. They also, though, function like campuses, much like Gary probably would talk about on his campus, where you have dining services, you have maintenance services, you have other types of individuals. They might be maintaining a swimming pool on the property. So there are lots of different types of workers in our field. And during COVID, we had to think through what is the real need here. And I would just go to a couple of the greatest challenges that I think were really highlighted. And, probably everyone read a news story last year, a headline news story, unfortunately, about a skilled nursing facility or an assisted living facility. I think there is a deep misunderstanding about the field out of hospital. People understand what it means to go to the hospital, but they don't know what it means to get care in the home. They don't know what it means to live in a retirement community. They don't know what it means to work in an assisted living community. So I think understanding of the field and misunderstanding about the field is really one of our greatest challenges. Another challenge, I think, I would say the second, is when do we start framing up these discussions to eliminate misunderstanding? If you think in grade school, in elementary school, high school, and even in college, there's very little focus in general on the needs of older adults. If you think about, there are some examples in schools, for example, in Ohio, where they teach the alphabet using words that focus on opportunities for work in the field of aging services. So housing, care, and services for older adults. And then the third challenge, I think, is how do we continue to elevate leadership in our field? So these pose real opportunities for us at LeadingAge California, and I think with others. One, as Tracey mentioned, is about partnerships. We cannot do it alone. There is absolutely no way we can pretend that we can function in a silo. And at LeadingAge California, we established a workforce situation room that really did cross disciplines, cross spectrums, members, non-members, entrepreneurs, students, a cross section of individuals. So building partnerships with a wide audience is critical as we try to bring more workforce into our field, as well as figure out what are the needs and demands of that workforce. A second opportunity is building awareness. 2 years ago, in 2019, we launched a campaign called Age On, Rage On. And you can Google that, ageonrageon.com. It was a very big campaign of ours to build awareness about the field of aging, about all of our services. But importantly, what are the needs of older adults and what are the needs for workforce in the field? So that has become a particular brand of ours where we focus on building awareness about workforce and the opportunities to serve older adults through meeting some of their needs as they age. And then finally, I would just like to say, training is really critical in the building of career ladders. So along with Unitek Learning, we are now establishing a partnership to build a career ladder that will start with CNAs or earlier, bring on CNAs in the workforce, then on to LVNs in California. We all know they're called LVNs, and then into nursing, into registered nurses. So we're really excited about this opportunity as we, again, lean on and depend on partnerships.
Thank you so much for sharing those perspectives. Jeannee, as a geriatric nurse practitioner, I certainly love your rage on, age on. And I think that, again, just helping people understand the extraordinary privilege it is to work in the senior, the aging field. I think that's just wonderful. And this whole notion of career ladders, of course, is something we all have to embrace universally. I know Gary's going to kind of follow up on those comments with perspective of his own as it relates to Masonic homes. So Gary, please.
Well, thank you, Mary Ann. And I just want to build on something that Jeannee discussed as well. And that's really the need for us to increase the awareness of the good work that's being done in the senior care industry. Right. You know, so often, and I heard this mostly on the acute side when I was working on the acute side of the world, I'd hear the nurses say, you know, when I get ready to retire, I'm going to go work in a senior living community. Right. It never seemed to be the career of choice for nurses. And I think we really have to work hard to change that perception as well. I can tell you, having been on both sides of the world, so to speak, that definitely, you know, it's such a rewarding career and experience to be able to work with seniors. So it kind of goes to what was the greatest challenge for us this year was, of course, recruitment and retention. And I will share with you one of the horror stories from our particular market where, you know, of course, we decided early on in the pandemic that we wanted to increase our staff by about 10%. As surge staff. So when we went out to start recruiting, of course, we had that challenge we always have. And come to find out that there was a facility down the street that was offering CNAs $50 an hour. Now, not only were we concerned about, you know, what that was going to do to our market, but we were concerned as to whether or not we'd have a lot of our staff leave us for that, because of course we're paying between $15 and $20 an hour. And CNAs were going down the street and making $50 an hour. That, of course, there were reasons for that. But, you know, becoming the employer of choice is critical as well, because it's not only about your ability to recruit, it's about your ability to retain staff. And retaining staff is just so important. When you think about how much it costs to recruit a staff member, putting a few extra resources into retaining staff is critically important. And about 5 years ago, I'll just share with you our personal experience. We decided that we had to change the perceptions of our staff, because in doing so, we would be able to also provide a better quality of service to our residents. And so we embarked upon a program, and we chose Disney to base our program on, because of course we're in California and every one of our staff members had been to Disney. They hadn't been to some of the other hotels that feature prominently in this market of being able to provide this customer service training. And so over the course of a couple of years, we developed something called the Masonic Homes Way, and it was based upon pillars such as safety, personal connection, experience, and efficiency. And all of our staff members are trained on Masonic Homes Way. And our goal was really to become a top place to work. And we were able to achieve that in 2 years. And I'm happy to say we're on our second year as a top place to work. And we are a top place to work nationwide now in the healthcare sector. So it's really almost doubled our satisfaction scores. Sorry about that. Doubled our satisfaction scores. And it also, of course, made a tremendous increase in our resident satisfaction as well. And so we fared incredibly well throughout this pandemic. We've had incredibly low turnover, even though there's a lot of competition out there for our staff. And I think that's put us ahead of the game. So, you know, we really think that there's a critical importance to being an employer of choice, not only for a career track, but also being the employer for all of these opportunities. So I think that's really critical for us to survive in this marketplace, especially with the competition being as fierce as it is. But we also need to do something, as I said initially, about making this a career choice for people, getting people to understand the importance of our market, the importance of what we do, and the importance of the position and the role they're going to play.
No, thank you. And that's really impressive that against those almost overwhelming odds for recruitment and retention, that the work you had done previously really put you in good stead to, you know, wrap support around your employees and ensure that they were committed to your mission moving forward. So congratulations. A lot for us to think about as we try to emulate those best practices, Gary.
Thank you.
Lynda, tell us a little bit about the unique challenges in your market. I know you're in a high cost of living market, so help us understand some of the challenges and opportunities that you've had.
Thank you, Mary. Yeah, you are correct. The high cost of living in Santa Barbara is a barrier, and with housing costs going up quite dramatically this past year, I think it's even going to be more challenging. So we work really hard to get people to come here. Many times they live in neighboring communities, but then they have to travel in. So we're looking at potentially in the future putting branch offices in some of those neighboring communities so that we could have a better, larger workforce. Also, the high cost of travelers. So because we can't attract nursing staff particularly because it's really challenging, we have to rely on travelers. Well, it's gotten very expensive if you can even find them. So we're willing to pay, but we can't, it's really hard to even find them. And then we're competing with our hospital system. We have one major hospital system in our area and they do pay very well. So we can't really, with the revenue that we get from Medicare and other insurances, we can't compete with those wages. We pay well, but not as well as they do. So that is another challenge. And so we focus a lot on our benefit package. We work really hard to have good benefits. And we are doing sign-on bonuses. So we're doing sign-on bonuses for staff that are fairly robust, that they can receive within 6 months if they stay. But then we've just implemented sign-on bonuses for staff that refer new staff. And so it's very expensive, but it's, you know, we have to have staff. So what are some of the opportunities out of that? Well, one of the things that we do promote is the autonomy and flexibility that you can have with working in home health and hospice or palliative care. So, you know, you're not 8 hours a day in an institution. You can make it work around family life. I know I was a home health nurse when I raised my children, and it really gave me that flexibility to be able to participate in things that I wanted to, but still get in my day and see my patients. And we also, like many of you, work on retention. We have very low turnover. And we've also had great opportunity with the travelers in that they have stayed. So we have converted many travelers to full-time employees. And so I think that that's a testament of the kind of environment that we have and, you know, the caring, and that we, you know, our tagline is live well, and we really work on caring for our staff, and our surveys show that they're overall quite happy. So Again, I think another opportunity is we're partnering with academic institutions, with LeadingAge, working on career ladders and giving more opportunities to our staff. Thank you.
It's just so interesting. We don't often hear of home care and community-based organizations, reaching out for traveling nurses, and that your effectiveness in kind of offering the exposure and then converting them into staff. I think that's really an important kind of takeaway for people participating on this call. So thank you so much for sharing it. I think, Lynda, you have certainly seen the vastness of the U.S. and how home and community-based services are delivered, even in your prior role in consulting and as an accreditor for Joint Commission. I think it might be helpful because we also have students on the call today. For you to kind of describe some of the roles that nurses have in home and community-based settings, because folks may not realize the range of opportunity available. As you said, you started as a home care nurse, that worked, and you loved that for a portion of your career, and now you're a CEO. So could you just kind of highlight some of those roles for us?
Sure. So I think nursing is like one of the best professions that anyone could go into. So I think that the amount of opportunities that you have and the diversity that you have in your career is just amazing. There's almost nothing you can't do with a nursing degree. And I will just add that I have a daughter that's a physical therapist, and she's done very well in her career, but she has said to me before, I should have been a nurse, because she could have gone even further. But if we just look at home care, I myself was a home health nurse. I carried a bag. I saw patients. I understand what it's like to be out there. And I've held many, many different roles. So you can work in quality. You can be an educator. You can be a coder and, now work remotely with that type of a job. You can be the director of nurses. You can be a manager, a supervisor, a CEO. There's just nowhere that you can't go with a nursing degree. And so I would encourage nurses out there to look at the home care field and also to look at advanced practice in nursing, because, I eventually went on to get my master's degree, and that has served me so well. And so I really encourage everyone to look at that and to look at home care. It's so rewarding, and you get to go into the home and you get to see patients in a whole different light. You get to see where they live and the challenges and what's in their cupboards and the medications and their environment and their families. And it's very rewarding when you can make a difference in the outcomes of care. And there's no position you can't hold as a nurse. And a nurse practitioner, again, they work in home care too. So right alongside the physicians.
I think you certainly have whet the appetite of everyone listening to our conference today. Well said.
And I will also add, I just wanted to add, they can be a consultant, and they can also be a surveyor. So all in the home care arena.
Terrific. And I know, Jen, you can also shed some light on that and, give us some perspective of the unique challenges and opportunities, but you certainly see a range of roles as well. So help us understand.
I was going to say, I might sound a little bit like a repeat of Lynda. From a challenge perspective, I think in assisted living, it's like many others, it's the recruitment piece. Assisted living is, in competition for all the nurses that everybody else has spoke is in competition for. I think one of our other challenges in assisted living, and Gary talked about it a little bit, is what does the nurse do in assisted living? Why aren't we a career path for nurses? I know at Atria, we've got a great program where we promote from within a lot. We have care staff who come in as an RSA, and then they become an RMA. And then they realize they are watching the RSD, who is the resident services director, which is a nurse position running the department, that, hey, I want to do that someday. They see the management piece. They go to nursing school while they're working for us. We help with their tuition. And then next thing you know, they're growing into a resident services director role. So, kind of like what Lynda said, in assisted living, you can do anything as a nurse. You can run the care department, which is where the assisted living services are. We have support teams, the DDCMs. Myself, I'm a national director of care. I work in the support role. We have nurses that have gone on to run buildings. I've ran one of our buildings. There's just so many opportunities as a nurse to work in assisted living. We have nurses who go into sales. It's just the opportunities are endless. And the rewards of assisted living are, you get to see these residents in their home because in their apartments and assisted living, it is their own home environment. So you see them excel, you see them maybe not do so well, but you're a part of that process to help them get back onto the path of healing. Or if it's a path of passing, then you're there to guide the family and the resident and work with the home health and hospice companies that are coming in to help through that process. So, there's lots of opportunities in assisted living for nurses. I think there's a big misconception sometimes. I was one of those nurses in the very beginning. I was like, assisted living? No. But then I finally, after many years of working in the hospital and skilled, I thought, okay, let me see what this assisted living is about. And 16 years later, I still am learning and loving assisted living. It's a whole different field, and it's, to me, one of the most rewarding fields I've worked in. So the opportunities are endless.
Thank you for sharing that. And I imagine one thing that's so powerful for a nurse in assisted living, in the direct care role, is the ability to have continuity of a relationship with a patient and family over time, which often, with lengths of stay decreasing in so many sites of care, that is sometimes somewhat lacking.
Absolutely. Yeah, having the nurse there from the beginning of the move-in through that person's aging process in the environment, they're always that person and that point of contact to be able to help the families and give direction and just be there for the residents when they need someone to talk to or they're not sure what a paper says that's been given to them. So it's a huge role in the environment.
Thank you. That's terrific, Jen. Thank you. Charles, you have a very unique perspective to share, I know.
Thank you. So one of our challenges, being an organization with a very singular focus of services, being the non-medical world, that means that we're looking for the non-medical caregiver, not necessarily a skilled nurse, but maybe on their way toward that, to elevate the importance of the positions that they have there in the home care setting. Certainly, training and experience is necessary. And so we've created an environment that attracts the diverse and inclusive environment for all kinds of folks. We start by first making it a very comfortable place, an attractive organization for the services to be provided. What do I mean by that? Well, in home care, we are called upon to do a variety of different tasks for different sorts of folks. We have folks that are in pediatrics. We have folks that are end of life. We have folks that are developmentally disabled, and we have folks that are in rehab. There are so many different care opportunities for the caregiver to experience while they're connected to a home care organization. Being in the home care field, as was mentioned already, is a position that you do alone. It's one-on-one. You're not in a team environment. And so developing the caregiver to understand their importance and elevate them so that they carry their own responsibility of being able to provide the services as expected, but also looking for things that might need to be reported. For example, some folks go to work and they do the same thing every single day. But when you're working with a senior who may be on a particular medication, every day may be a little bit different, and reporting back to some of the signs and symptoms that could be detrimental to their health just may have saved that person's life. So the caregiver really is the first responder, the first person to be able to provide the hands-on care and to save lives every day. One of the things that I think it goes a very, very long way is that caregivers that are able to see that there's someone that looks like them, that is able to relate to them with the same similar story. So we create a virtual community so that the caregivers can come together, tell their story, and provide support from within on a monthly basis. You know, we used to have what was called a lunch and learn. Well, that went out the window last March. You couldn't come into the offices anymore. And so we now have the ability to connect together just like we are right now. And right now I see 9 people on my screen. It's very exciting, but we're all able to still connect to each other and not have an hour's worth of travel. These are the things that are important, that when you're working with kindness and empathy, to be rewarded for a particular skill. That is, this was the kindest person I'd ever met, and they came to my home and treated me with respect and dignity, and they were rewarded for that because they also got that same feeling. Now, I talk about the diversity of clients. You know, this is a very, very good opportunity, especially for young people who are trying to decide what is going to be their advanced educational background and skill focus for education. I don't know of any particular position where you can have hands-on learning and go, yep, I'm going to be a pediatric nurse.
Yeah,
And
that's so interesting.
this is what's exciting for our group.
Yeah, I think you've raised an interesting point that, you know, hasn't come up yet in our panel discussion. You have an opportunity to touch lives across the lifespan. And sometimes I don't think folks know that in home care and hospice and community-based services, you can care for children, as you said, the developmentally disabled, folks who are aging, folks who are dying, folks who are just born and maybe struggling. So I think that's an important takeaway, particularly for those listening who have not had the exposure to home and community-based services. So that's just terrific. Thank you. Rayne, opportunities and challenges in your role with the, you know, tens of thousands of nurses with whom you interface across the Kaiser family of enterprises.
Yeah, thank you, Mary. And I think, you know, my colleagues touched upon many of the key tenets in terms of the challenges. And I think, you know, coming from and working in an integrated system, one of the things, you know, whether you're a student or currently in practice, one of the things we don't highlight enough is the connection between our settings. You know, we talk a lot about the continuum of care, yet once patients are discharged from the hospital, we often scratch our heads as to why they're getting readmitted within 72 hours. Well, what happened in that space, you know? And if truly our goal is to bring care where patients are or where people are, hopefully that care isn't always in the hospital, because, you know, hospitals, emergency departments, facilities are, you know, the exception. You know, no one signs up to come into the hospital as if it was a vacation, right? And so it's often an acute episode, an emergency. And so although, you know, in nursing education, just like we have today, a lot of our training is indeed in the acute care space. And so, you know, we often joke that once you become a med surg or telemetry nurse, that seems to be your career path forever. And so that's the challenge for us, is how do you expose, you know, nursing students, people looking into nursing, people looking into healthcare, into other fields across the continuum of care. And then looking at, you know, those opportunities, because and the weight of the responsibility in order to make sure patients and people don't have to get hospitalized if they don't have to, because often, as we know, hospitals aren't the safest places to be for our patients, much less our visitors. And, you know, with the pandemic that we're talking about, we can't even have visitors. And so it's that moral dilemma that many of us face in our traditional settings. And so I think the opportunity for us in looking at those connections across the continuum of care, I recently read there was a really successful new grad program in the home health setting. And so why not start developing not just the marketing as to the importance and the excitement that could be in home care, but really putting our money where our mouths are in terms of investing in new grad programs, development programs, shadowing. One of the things again is, why can't I work in the hospital and, the home care setting? And so being able to float to see those connections and appreciate that what I do in the hospital matters when the patient gets home, whether that's patient education, reinforcing translation services, social work, pharmacy services, a lot of the things, again, that we often have blinders to in our educational programs in the hospital, because we're just so focused on surviving that 8-12 hour shift and making sure patients are safe and receive high quality care, that discharge process is often rushed, right? It's often, oh my gosh, I better, send you with these packets of papers and hope that you can navigate, once you get home, how to get primary care or, pharmacy care, nutritional services. And so there's a lot, I think, of investment we have to provide in terms of education, not just to our acute care nurses in terms of the importance of home care, skilled nursing, hospice, all of those services that are important in order for our patients and our families to remain at home where they probably want to be and receive high quality care and know that they can connect with us whenever they need to for advice and services. So a lot banking on expanding our educational opportunities, connecting with schools such as Unitek on looking at what those programs might look like. And then again, connecting with students who might be scared of blood, but not knowing that there are other opportunities aside from the ED and critical care, that you can be a really awesome nurse to our patients and families in, such as the home, which is where it really is about in terms of taking care to where people are. So thank you so much, Mary and team. Oh, you're on mute, Mary.
Sorry, I love that. And I love the notion of the shadowing concept so that we continue to give people exposure. Certainly we want it embedded in the academic curricula, but wouldn't it be great if, particularly in an integrated system, as you said, with Kaiser, we could offer those opportunities, but we could do it in partnership between, systems of care like we have represented on the panel today. And I've often wondered who would be the first, and maybe it's you, Rayne, who will develop that nursing role that does allow folks to carry patients from the inpatient to the other settings of care, whether it be assisted living, subacute, home, hospice. I think, wow, that would be like a home run. And perhaps as we more broadly think of population health and case management, that very role will be developed. I know. So Thanks for raising that as an opportunity.
And if I could add briefly, since Lynda is here and worked at the Joint Commission, it's similar to what we do with the tracer methodology, right? In terms of if you can't explain to your patient the path of care through their different phases, whether it's home health, hospice, especially hospice, palliative care, major life changes. And as advocates for our patients, we should really have those concepts under our tool belt, much less be able to explain what patients should expect, at the next level of care, wherever that might be. And we started with our physician groups, actually, who, talk about myth busting about skilled nursing, home health, really taking our physician leaders to those settings, meeting administrators in those facilities to really get to know the services and the care, the high quality care that our patients are getting. Otherwise, physicians continue to carry on sort of the rumor mill or the anecdotal, oh, don't send them there, or that's not the right place to go. And unless they see it for themselves, it's really hard to convince them that, there is a lot of opportunity for high quality care, in many settings beyond the acute care space. So thank you, Mary.
Well, thank you. So important. Well, now I'm going to pivot a little bit, and I might mix the respondents up a little just to really keep the panelists on their toes, because I am a little bit focused on time, but just terrific dialogue. How did the pandemic impact your nursing workforce, and what are some learnings and long-term implications? And Jeannee, I'm going to let you kick that off because you had the benefit also of sitting on the federal commission, and I think there are probably learnings that are important for all of us to hear.
Right. So thank you, Mary Ann. And, you know, the great thing about being on a panel like this is that you learn the entire time that everyone else is talking. So I'm taking so much in as each of you are speaking. And likewise, on the Federal Coronavirus Commission for Quality and Safety in Nursing Homes, which was a panel of 25 people from across the country, including consumers, I had an opportunity to learn about workforce issues at the state level, but also at the national level. So it was really critical to understand the variations across the state and how different caregiving professionals are perceived. So, for example, a nurse's capabilities in California, we have a different scope of work than you might have in another state. A certified nursing assistant may have a different scope of work in another state, et cetera. So it was really important for me personally, but also for our members here in California to better understand the spectrum of perceptions across the country, even though in my prior roles, I had all those roles that Lynda talked about, from carrying the bag. I was a true public health nurse in another country and several other countries. So I didn't even have the benefit of a home health structure, but really just going door to door, checking on people throughout my career, having advanced and realizing that everyone has a little bit different perspective. At the Coronavirus Commission, which was focused on skilled nursing facilities in particular because of what was happening particularly last spring, a year ago in 2020 with coronavirus, what I learned then is the value, and to a degree, what I said before about awareness, about education, and about preparation, really training. So I think those three learnings from the Coronavirus Commission were probably of the most important, because we had perspectives from academia, perspectives from other provider types, researchers, deeply knowledgeable people about different aspects of, in this situation, nursing homes. So I think as we look forward, the pandemic helped to frame some of our thinking at LeadingAge California related to partnerships, related to the career pathways that are needed, and also to how we increase the number of workers here in the field. The number, I think, that was given in Dr. Emerson's presentation, I think it was he or Tracey maybe, who said the volume of workers that are going to be needed is very, very dramatic. And I don't think we quite have a handle on how we're really going to increase the numbers when there just aren't enough people, there aren't enough population coming up through the ranks. So there's a sheer volume of need, and there's a deficit of actual people to do the work. So we're trying to think about that universal worker. How does a nurse go across fields that you were just mentioning? How do you go from one setting to another? How do you create a universal worker so that you might have broader capabilities that might have been identified in your scope of practice? So those were all learnings from the last year of the pandemic. And I think they're going to continue to inform us for the next 10 or 20 years.
Yeah, so interesting, that notion of the universal worker, kind of it ties back to how Rayne was suggesting that shadowing, or that we almost kind of knock down the silos between our settings of care, because in many ways we've constructed them, right? So really powerful. Charles, you did some very interesting work during the pandemic to honor your commitment to employees. So help us understand some of the learnings you took from the pandemic.
Well, it was a very scary time for for a lot. There was not a lot of information that was coming out of the government. The standards were very confusing and contradictory at times, especially in the beginning phases of that. So what we did is we decided that we needed to look to the experts to make sure that our workforce was protected as much as possible in the care setting that they were working in. So knowing that they were probably not going to be encountering concentrated danger, like an emergency room or another setting, we needed to know what we had to do. And so once we figured out what all of those things were, we educated every single person. We started with education. We made sure that they were comfortable. We made sure that they were able to follow the instructions without supervision. And that was the key, is that everyone had to be competent in their own way. And so for many situations, our customers decided that it would be better to go without care. And that was just heartbreaking. And so for most agencies that didn't have care, they would lay off their staff. Department of Social Services reached out to the home care industry and said, who among you will be willing to help those that cannot be moved to an emergency room or an acute hospital? Who among you will be able to help the facilities that have staff that themselves are now in quarantine? So many, it wasn't just the resident or the patient that was experiencing it. It was also the workforce that had to be extracted. So we were able to provide staff to these particular locations all throughout California, 95 locations actually during the actual period, to help with the actual replacement of caregivers, while those folks who were in quarantine were able to complete the process. And then once they were ready to come back, we then redeployed our staff elsewhere so that we could continue to help keep people in the place that they needed to be, rather than putting them into, the overflowing ICUs and all of those things that were currently happening. It was a huge effort that included all of the public health. It included each county. It included the departments in Sacramento reaching out. It included emergency financing. I mean, it was amazing and a privilege to be part of that process here in California. It really was.
It's interesting, Charles, going back to kind of the points that Rayne and Jeannee were making, you kind of did break down those silos for patients, and you kind of you created that mobile asset in home and community-based care on a dime. So I think we can learn a lot from you and think about how Unitek Learning and others can support kind of that notion that we have to be flexible as caregivers and as employers support our employees in that. So terrific takeaway for all of us on the call today. Thank you. Now, Jen, I'm going to ask you to kind of respond to that, but to also do it within the context of our next question, which is, thinking about the pandemic and all the work that you've done and your organization has done in facilitating that employer of choice concept. So share some of your learnings with that.
I think one of the things that I thought was pretty impressive is, I'm sure most of us, we heard it in the news about finding PPE. In the very beginning, everybody was struggling just to get PPE to protect their staff in the environment. Something that happened at Atria is all of our communities, we got PPE for all the communities, but then each employee was sent a box of PPE so that as our employees were going back and forth to work, they could be protected. If they had to go to the market, whatever the case may be, everybody received an initial box of PPE. And to this day, if an employee comes in and says, I'm still scared, I need masks, I ran out or whatever, we're still supplying our employees so that even outside of work, they have that protection and that peace of mind as they're, going about their daily life. A lot of staff have really shared that meant the world to them, having groceries delivered to their houses so that they didn't have to go to the store. Just those kind of things that we don't always think about on a day-to-day basis that you don't think make a difference. And then you realize, wow, that was a huge impact. I mean, for me, myself, when my box showed up at my house, I was like, oh my goodness, because I'm fretting at home not having PPE. And then I get a box. I was like, this is amazing. So that was a huge thing. And our employees talk about it. They were posting about it, which that puts this positive vibe out there. And that really helps. I think in regards to the next question, as you said, for how do we become the employer of choice? I think social media is a huge help. Whether it's recruiting and posting about those positions that you have available. I think sometimes we're all like, oh, I don't want to say how many open positions I have, but sometimes those relationships you have, whether it's, Facebook or those, but more so like LinkedIn, we all always help each other. So it's like you put that out there and of a friend that maybe that is looking and isn't for your venue, but maybe assisted living or home health or whoever it might be the right venue. And, I think getting that out there, putting your great things you're doing in your environments, to what Charles did or what great event is going on in a community or home health, putting that out there to show what's happening. We've all had to learn to do that it's okay to share. I mean, you don't want to share everything, but sharing the things that are happening when you've got PPE, what your staff are doing. Celebrating your staff is huge. If you celebrate your staff talk about that, and then they want their friends to come work. So it's a great environment. I think those are things that you can do to help yourself become the employer of choice. And have people know who you are. That's a big thing too. I think it's scary to go work for somebody that you don't know what they do. So making it commonplace what your company does in the environment, I think is important.
Thank you. That's terrific. I just love the box arriving on the doorstep, right? I think we've learned, and I hope we continue to embrace the notion how traumatic the past year has been for folks who are caring for others, and that we continue to attend to those. So just a great example. Thank you, Jen. Gary, you had talked a little bit about your Disney Institute pillar experience. Are there other things you'd like to share with us about being an employer of choice?
Yeah, it's interesting. When the pandemic started, the first thing we focused on were our employees. We of course knew the fears they were going to have. We have skilled nursing and high level assisted living. And that's unfortunately where so many of the deaths were taking place in our community. And we were incredibly fortunate. We had very, very few residents and very few of our staff that tested positive. But we immediately instituted a program called We Care. And the first thing we gave away was 30 pounds of groceries to every one of our staff members. And we continued every single week giving them something. And I will tell you, the most popular thing we gave away, toilet paper. You
needed it.
Yeah, you think we'd given gold, but the point of it was that we were very focused on our staff members and very, very focused on making sure that they felt comfortable and that we had the opportunity to give them things that were important to them and to their families. We also did something called the Heroes Day, and everyone was given early on a day off with pay. It didn't count against their PTO, and that went over really well. And so in July, when it looked like things were, did of course linger on with the pandemic, we gave everybody a Heroes Week off. So everybody got an extra week off, and that we encouraged them to take it off by saying there'd be no cash value and it was a use it or lose it, because we really wanted people to take the week off and get some rest. And that, of course, has been followed as we've just continued on, right, through the pandemic, through another day off and another week off. And I think demonstrating to your staff that commitment you have to them and to their families really helps demonstrate that you're that employer of choice in the marketplace. And I forget, I don't know if Tracey said or Jen said about word of mouth, right? If your employees go out and say, look at what Masonic Homes did for me. I have a week off because of that, right? Everybody's going to say, I think I want to go work for the Masonic Homes. And so I think these things are critically important. You have to demonstrate that you really do have a commitment to your staff, that you really do try to understand and care for them. And that goes a lot further than money. So.
Great, thank you. Now I'm getting a little nudge, that we have to kind of think about wrapping it up. But before we do that, if very succinctly, we could answer the question, what is one thing that academic partners like Unitek could do right now for your organizations? And we have to be very brief on this. I'm going to ask Rayne, Tracey, and Lynda to respond to that in the order of Rayne first.
No, I think just staying connected in terms of the trends, the challenges, the opportunities, and having an open dialogue in terms of innovating and really getting rid of the box, not even thinking out of the box, but getting rid of the box. If the pandemic has shown us anything, is that, we got to just be together in this journey and innovate and develop new programs together. And I'll be talking more about that soon. So thank you.
Thank you, Rayne. Lynda. I think you're on mute, Lynda.
I would say, being succinct, collaborate with us in creating a path for entry-level positions in home care.
Great.
So really, and in introducing that in their curriculum, home and community-based services.
Absolutely. Hear, hear. Tracey, take us home.
Yes, I think I would ask my academic partner to lean into the concept of each nurse working in the right position, in the right setting at the right time. And to everyone else's point, really understanding the opportunities that are out there. In home care, we need to teach nurses to be teachers, and who better to do that than an academic institution? Thank you.
Thank you so much. And I'm going to allow Bill to share some of the learnings and just last minute comments.
Let me get off mute there. No, this is an excellent discussion, and I agree. We have a huge problem and shortage of home health care nurses, as well as in the academic institutions of training. So we need to put an emphasis on that so that we can help alleviate the shortage in the future. Thank you.
Thank you, Bill. And thank you for this extraordinary discussion. It makes me want to start my nursing career all over again. And I would love to span the entire continuum all over again. Like, what joy this has been. And thank you to the participants. And I thank all of you for leading organizations through through clearly the most disruptive, almost horrendous time in our history. Your dedication to nurturing your employees, leading with courage, honoring patients and families, and for those who are participating, who have done the same. It just gives me such joy, and I feel so privileged to have been with all of you today. So here's to great work, here's to your courage, and I hope you are all taking care of yourselves as well. Your treasured colleagues, thank you.